So, very good afternoon, everyone. I'm Deepanshi from Delhi Pharmaceuticals and Sciences and Research University. Welcome to my presentation today. As you can see on my screen, today's talk, which is relevant and particularly associated with the most recent and research topic, that is to compare the therapeutic efficacy of the phonophoresis and the iontophoresis in the management of the patient with knee osteoarthritis in older adults. So, as we know, the OA is the most prevalent form of the arthritis. So, as the research demonstrated that OA is the inflammatory disease which can affect entire the synovial joint. As we all know, it's not a curable, but yes, it's a strong and the cost intensive efforts which can improve the care, quality of life, pain relief of the OA patients. And yes, there is a broad spectrum which is generally which ranges from the general measures to the physiotherapy, therapeutic aids, or the orthopedic aids, and orthosis along with the pharmacotherapy, and finally the surgery is the last option for that, and the rehabilitation. And as we know, rehabilitation is very compulsory to get back patient into the normal life. So the need of the study is like it's why? Just because the patient is consuming lots of painkillers and NSAIDs nowadays, so it's not a safer option for the patient. Just to relieve their symptom, to manage their pain, they're just taking a lots of painkiller and the NSAIDs. Just and after that, the patient suffered with some serious complication and has the major side effects. For example, the GI increase the risk of the GI bleeding and systemic toxicities, myocardial infarction, and the strokes as well. So, yes, the electromotive therapy with the therapeutic exercise are the most effective and the safer for the patient who are suffering from the knee OA. And yes, endomethacin, it's found it's a really excellent medication which has as the researchers found, it's a anti-inflammatory, and it has the effect of antipyretic and the analgesics property. So for this medication is particularly used for the to treat the rheumatoid arthritis and the gout. For this medicine has like never used in the research study. So this is the only medicine which I have used in my study at the very first time. And yes, it gives an immense excellent effect on the patients to manage their symptoms, and obviously, and to reduce the severity of the patient while who are taking or who are consuming orally these drugs. So for yes, it's the efficacy of the treatment from mild to moderate osteoarthritis, which is not proven yet by apply this medication, while the iontophoresis and the phonophoresis technique is not proven yet. So it's also in need of the study, and the aim of the study was like which technique, phonophoresis or the iontophoresis, in the management of the OA, along their clinical parameters, which technique is best. So, uh, hypothesis was alternative and the null hypothesis was taken, and these are the review of literature. These all are the studies which found my study, which is like really help for my study. And the method was, yes, the study design was just a randomized control trial was taken. There were the 30 subjects were selected for this particular criteria. And yes, the selection criteria was based upon the inclusion and exclusion criteria, and the people from age group 45 to 60 years were taken, along with them having the patients having the osteoarthritis at the mild to moderate range from grade 1 or 2 according to the classifications of the Lawrence, as I mentioned here. So with this all selection criteria was, along with the patient should be well tolerated with the endomethacin gel. And the exclusion criteria was, which I have not included in my study, the patients who are having the previous knee joint surgery, or any any fracture past in 3 months, or any or he or she has taken any kind of injection or any steroids, and the patient who are having the neurological and the cardiovascular event, and the patient who are suffering from the any psychiatric problem and the psychological problem as well. So the method of selecting criteria and the assigning subjects was convenience sampling method was used. The random assignment also were used for this, and there were the two variables, that was first was the dependent and second was the independent variable. Dependent variable was the pain, walking speed, quality of life, and the sleep quality of the patient, which was analyzed by some data collection tools were taken. For the pain, that the visual analog scale was taken, WOMAC for the quality of life, cadence walking test to just analyze the walking speed of the patient, and Pittsburgh sleep quality index scale, which just to analyze the sleep quality of the patient. And the instrumentation was taken, the drug, that is the indomethacin and TENS, and the therapeutic ultrasound. And this the protocol was, the ethical clearance has been taken from the committee, the ethical committee from the Deepanshi, and the subjects was selected by the convenience sampling method, which is just based on the inclusion and exclusion criteria which I had just mentioned. So all the subjects were randomly assigned into the three groups, and the one group, the subject who received the iontophoresis along with the 1% of the dosage, that was the indomethacin, and the second group, that was the Phonophoresis, who received the 1% of the drug dosage, and the third group was the conventional group, who received the conventional therapeutic exercises as the research study mentioned, along with the 10 minutes of the moist heat pack. And all this criteria, all this protocol were followed up to the 3 days in a week, 3 days for the 4 consecutive weeks. And all the protocol was taken on the alternate days basis. So following this set of protocols for the intervention, once the data has come, so all the data has been analyzed by the software, that was the SPSS, which is used and at the School of Physiotherapy, Deepanshi. And the clinical relevance of the study, as I mentioned, yes, the osteoarthritis is the most prevalent and it's the most common degenerative disease. So the patient who are taking the medication orally for from a prolonged period of time, especially the NSAIDs and the painkiller. So basically, these medications are associated with the serious complications. For example, peptic ulcer, neurotoxicity, and any kind of systemic toxicities as well. So, in contrast of this, just to overcome this major or the serious complications while patient taking these medications, so I opt a very safest and a very beneficial or advantageous option for the patient, that was the transdermal drug delivery. While I deliver a drug, that was the endomethacin, again it's a NSAID, with the zero side effect to the patient, to improve the symptoms, to manage the symptoms of the patient, along with to prevent the progression of the particular disease. So for yes, it is the safest and the alternative option for a long time of the usage of the SAIDs, that is a non-inflammatory medications. So the modern therapy, electromotive drug administration, it's a non-invasive treatment and it's a most safer option nowadays, not just for the older patient, but yes, it also enhances the quality of the physiotherapeutic setup, like in the treatment strategy, I can say. So nowadays, if we opt this particular method in our daily practice to treat the OA patient, instead of ask the patient to take any or to consume any kind of NSAIDs and the painkillers, which may lead to the further severe and the serious complication to the patient. So we can opt this a particular and the safest option to alternative that. So yes, moreover, I can say both the methods are very useful. That is the iontophoresis, that Phonophoresis techniques is really a very excellent technique. Data analysis and the result has been done. After the result, in result, I can say there is no statistically significant differences which I found in post. But yes, amazing. it like I found there is a amazing improvement in the patient. I have seen that in the clinical parameters in both the groups. That means I can't say like um Iontophoresis is better than the Phonophoresis. I can't approach this, but yes, both the mortality is found excellent, and it has and it gave the a very advantageous and beneficial for the patient for to manage their pain and to manage their clinical parameters, as I mentioned in the variable. And along with it, it has a it came with the zero side effect after taking the all this treatment strategy. And yes, the discussion part was both the modalities found very effective, and generally it's well tolerated for the patients. And yes, I can say this medication is a very safest option for the patient. And the limitation of the study is there were the less number of sample, and there was no too much like a prolonged follow-up they needed, and also to check the reliability of the therapeutic effects after a long period of time, after a long period of intervention of the treatment, and also assess the probable cause of that. There is a more I might say there might be the more good effect of the endomethacin gel as well. So the future scope of the study, the therapeutic, it also like increases the physiotherapeutic approach while treating the patient who are having the knee OA, and also reduces severity of the population, and also enhances the physiotherapist therapeutic setup as well, and also reduces the major serious complication, and also not last but not a least economic burden. The patient invested their medical expenditure directly or indirectly. So that supporting studies which I have taken for my study, and at the end, the conclusion, I can say there were in the clinical parameters in both the group, neither I can say the modality is superior to the other in terms of the clinical parameters, but yes, there was no significantly difference have been found in post core variables. But yes, Iontophoresis and the Phonophoresis, both the modalities show the excellent effect with the zero adverse serious complication effect. So I can say it is the most safest and the alternative option for the patient. The patient should opt this kind of treatment strategy to get their health in a better way, I can say. And also it also prevent the progression of the diseases as well. And these all are the references which I've taken for my study. So at last, thank you so much. If you guys have any question, you can free to ask anytime. And thank you so much for this. Thank you.